I think these are key amendments in our deliberations. They were discussed at length at committee, but I do want to echo the points made about where did this come from. I mean, when this was discussed at the committee, and in fairness, the Dutch representatives were incredibly good, and this certainly didn't come from them. So any idea that we're basing it on the Dutch model or anything, it isn't. But it was designed to facilitate and encourage careful decision-making. The Dutch service is very much based on women consulting with their doctors, but the woman's decision and input actually being really the key one. And I think all of the points that we've made is that no woman makes the decision lightly. When she decides to make an arrangement with her doctor, she's already given the issue an incredibly serious amount of thought. And we have to see this provision in the context of other provisions and restrictions that are there. And it is the combination of those factors that make the waiting period a barrier. It's not like the Dutch service, where abortion provision is much broader. They're not, if you like, on as strict a clock with 12 weeks. The circumstances where they can access abortion are far more broadly available. And then, so the decision to implement it here in this way, if it's not amended, will act as a substantial barrier. And other deputies have made the points about that if you're keeping your 3-day limit, which we know that is the case, but we really have to get real now on when we're saying that, and it should be the date upon which an appointment is requested. For all of the reasons highlighted, the geographical inequality, the problems in our health service, the difficulty in getting a doctor's appointment and all the rest, that's a reality. And by combining that with this, the provision as is currently constructed, it does mean that the clock could tick and mean that women who are in danger of exceeding the 12-week limit are in a situation where they're forced to travel or access an unsafe abortion, which was one of the key scenarios in putting forward this legislation that people didn't want to have because it causes delays, and delays mean harm. So I think it's critically important that it has to be the date upon which the appointment is requested. I also think that the amendment number 34 is key, and what that's saying is that unless the 3-day period is overly burdensome to a woman, including because it might contribute to her exceeding the 12-week limit. Now this is absolutely critical in the context of those vulnerable groups. And I used the example last night of the challenges for deaf women, that the helpline phone option is of no value to them. A website isn't much value either when a big chunk of the country doesn't have access to broadband and all the rest of it. It's still not good enough. I think in a situation where a deaf woman needs to see a doctor, there's an added burden of procuring an Irish Sign Language interpreter to go with her. There could be a significant shortage of qualified interpreters available, even smaller numbers who are actually experienced in a medical setting, which is difficult. The woman may not want to bring her family along and so on for privacy issues and so on. They may live in a rural part of the country where it's even more difficult to get a sign language interpreter and so on, not to mind all of the other barriers. So in circumstances like that, there has to be an option for a waiving of the 3-day period if there is a risk of it going over the 12 weeks. And I'm particularly worried, and I would hope you would address it, Minister, in terms of how you envisage a scenario where, say, a woman in a domestic violence scenario, or, say, a woman who is coming from a remote direct provision centre sometime, how is she going to attend the second appointment after 3 days? Now, you kind of led us to believe at committee that Section 12 might be used to waive the waiting period in these scenarios. I think on the basis that the doctor believes, but we need to put that on the record, absolutely, because there has to be a facility for waiving that period. Otherwise, we're in danger of forcing people to continue to travel who are at that juncture.